Assemble equipment to ensure that it is available, accessible, safe, and ready to use. Antimicrobial soap along with the sterile brush and nail cleaner helps reduce or prevent bacterial infection. Use disposable towel to dry the hands. To avoid harboring dirt which cannot be effectively removed by hand washing. Remove jewelry because bacteria and dirt can remain beneath the jewelries after hand washing. To prevent the chance of acquiring or passing an infection. To prevent cuts and abrasions that can become contaminated with bacteria. PPE prevents exposure to blood and bodily fluids splashing during procedure. Turn on the water and adjust the flow so that the water is warm. Warm water removes less of protective oil of the skin than hot water. Apply liquid soap because it is very effective at removing dirt, organic material, and any loosely adherent transient flora. Because friction helps to loosen resident bacteria that can adhere to skin surfaces. To ensure coverage of all spaces and surfaces. To eliminate transient microorganisms and reduces resident hand flora. Scrubbing is performed from cleanest area or hands to marginal area or upper arms. To remove dirt and organic material that harbor large number of microorganisms. To ensure that there are no remaining dirt inside the fingernails. To ensure that each plane of the finger is thoroughly clean and free of dirt. Circular motion helps cover necessary skin area and better cleaning movement. Repeat the procedure to the other hand. After the hands, we should proceed to the arms. To wash and clean each section of the forearms with the right amount of circular motion of the brush for better scrubbing. To eliminate transient microorganisms and reduces resident hand or arm flora. To avoid compromising the cleanliness of the hands. Drop the brush after using. To avoid compromising the cleanliness of the hands, since the hands remain the cleanest part of upper extremities. To avoid retracing of water from elbows to hands. Water can contaminate a sterile setup. To ensure the sterility of scrub suit or gown. After hand washing, ask the coworker to turn off the faucet because below waist level is considered unsterile. To prevent accidental contamination. To avoid sterile towel from contacting unsterile scrub attire and transferring contamination to the hand. Dry the skin from cleanest area, which are the hands or fingers, to least clean, which are the elbows. Repeat the procedure to the other hand. Dispose the towel to prevent accidental contamination. To avoid touching the inner sterile wrap. To maintain aseptic technique, preventing contamination and transmission of microorganisms. To remove transient and resident bacteria from nails, fingers, hands, and forearms. A sterile gowning procedure. This is to prevent accidental contamination of the hands and arms. To completely enclose underlying garments inside the gown. Have a co-worker to assist you. The other person must be cautious or careful in order to prevent contamination. Using of sterile gloves, sterile forceps, or drape can help maintain aseptic technique. Have co-workers secure the ties behind the gown to ensure that the uniform is completely covered. The sterile gowning procedure helps the nurse and the patient to be completely safe and protected. To maintain cleanliness of the hands, a sterile gown cuff touches a sterile glove surface. To position glove for application over cuffed hand, keeping glove sterile. To touch the sterile glove using the sterile gown. This is to prevent exit of microorganisms over operative sterile field because of the seal created by the glove cuff over the gown. Pull the sleeve up to draw the cuff over the wrist as you extend or push the fingers into the glove's fingers. Repeat the procedure to the other hand. This is to maintain the principle of sterile touches sterile. Extend the fingers into the gloves as you pull the glove up over the cuff. This is to ensure that the nurse has full dexterity while using gloved hand. When worn, a sterile gown should be considered sterile in front from the waist to the shoulder. Maintain sterility to prevent contamination because contact with a team member can contaminate gown and gloves. The gown must enclose the undergarments and the front gown should always remain sterile. Thank you for watching.